This nasal spray is used to temporarily relieve nasal congestion caused by conditions like the common cold, sinusitis, hay fever, and allergies. It works by narrowing the blood vessels in the nose, which reduces swelling and congestion. The recommended dosage is usually 2 to 3 sprays in each nostril every 10 to 12 hours, and it is best to use it at the first sign of congestion. Make sure to read and follow the instructions on the label, and consult a doctor if you have any concerns or questions. To use this medication, spray it into the nose as directed. Make sure to follow all the instructions on the product package or as directed by your doctor. If you have any questions, don't hesitate to ask your doctor or pharmacist. Before using the drug, gently blow your nose. Then, use your finger to close the nostril on the side not receiving the medication. Keep your head upright and place the spray tip into the open nostril. Spray the medication into the open nostril as you breathe in through your nose. Sniff hard a few times to ensure the medication reaches deep into the nose. Repeat these steps for the other nostril if necessary. Avoid spraying the medication into your eyes or onto the middle of the inside of your nose, nasal septum. After each use, rinse the spray tip with hot water or wipe it with a clean tissue. Make sure that water does not get inside the container and replace the cap after each use. It's important to note that this medication provides only temporary relief. Do not use it more often, use more sprays, or use it for longer than directed, as doing so may increase the risk of side effects. Also, do not use this medication for more than 3 days, as it may cause a condition called rebound congestion. Symptoms of rebound congestion include long-term redness and swelling inside the nose and increased runny nose. If this occurs, stop using the medication and consult your doctor or pharmacist. If your condition gets worse or lasts after 3 days, be sure to inform your doctor. Some common side effects of Neo-Synephrine spray, non-aerosol, include temporary burning, stinging, dryness in the nose, runny nose, and sneezing. If these effects persist or worsen, consult your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as changes in heartbeat, dizziness, nausea, headache, mood changes, trouble sleeping, shaking, unusual sweating, or weakness. While very rare, a serious allergic reaction to this drug may occur. Seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects. Contact your doctor or pharmacist if you notice any other effects not listed above. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, report side effects to Health Canada at 1-866-234-2345. Before using Neo-Synephrine spray, non-aerosol, make sure to talk to your doctor or pharmacist if you have any allergies, especially to sympathomimetics. This nasal decongestant may contain inactive ingredients that can cause allergic reactions, so it's important to check with your pharmacist for more details. If you have certain health conditions such as heart or blood vessel disease, overactive thyroid, diabetes, high blood pressure, or difficulty urinating due to an enlarged prostate, it's best to consult your doctor or pharmacist before using this product. Before undergoing any surgery, be sure to inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are considering using this nasal spray for your child, it's important to check the product package or consult with your doctor or pharmacist to see if it is safe for children. For pregnant women, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if this drug passes into breast milk. It's important to be aware of any potential drug interactions that may occur with Neo-Synephrine spray, non-aerosol. Certain medications can affect how Neo-Synephrine spray works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. In particular, taking MAO inhibitors with Neo-Synephrine spray may cause a serious and potentially fatal drug interaction. It's important to avoid taking MAO inhibitors, such as isocarboxazid, linezolid, metaxalone, methylene blue, moclobamide, phenelzyne, procarbazine, razagiline, sulfinamide, selegiline, tranylcypromine, during treatment with this medication. Most MAO inhibitors should also not be taken for 2 weeks before treatment with Neo-Synephrine spray. Be sure to consult your doctor about when to start or stop taking this medication. If someone has taken too much Neo-Synephrine spray, non-aerosol, and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include drowsiness, slow heartbeat, dizziness, and fainting. It's important not to share your Neo-Synephrine spray, non-aerosol with anyone else, as using the same container as someone else could spread infection. It's always a good idea to speak with your doctor or pharmacist to determine which nasal decongestant is the best option for your specific needs. Neo-Synephrine spray, non-aerosol, is used for temporarily relieving nasal congestion due to the common cold, hay fever, or other upper respiratory allergies. It may also be used for other conditions as determined by your doctor. This spray works by narrowing the blood vessels in the nasal passages, which helps to open the nose and make breathing easier. For the most effective results, it is recommended to use this medication as directed by your doctor or follow the instructions on the package. This spray is usually administered as 2 to 3 sprays into each nostril every 4 hours as needed. However, it is important to not use this spray more often or for a longer duration than directed. It is best to use this medication at the first sign of nasal congestion to alleviate symptoms and improve breathing. Make sure to check the storage information on the packaging and keep the Neo-Synephrine spray, non-aerosol, away from heat and light. It's important to keep all medications out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you're unsure about the best way to dispose of it, consult your pharmacist or local waste disposal company for guidance. Remember, it's important to handle medications responsibly to ensure the safety of both yourself and the environment. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.